1,000 miles away from the Philippines come here and help the Philippines. So we are not forget friends. We are not forget the assistance that we get from the Philippines during the World War II.
Hello, 1, 2, 4,
And
1,
the
2,
and the help when you vote in the United Nations for our independence. And we are not forget that you sent a battalion to the north part of Israel, border between Syria and Israel, to keep peace between those two countries. Therefore, when you need, we are here. My soldier land and start acting in the north part of Cebu, in Bogo City, because it was your request, and I feel, as a commander, as an officer in the IDF, as a Jew in Israel, as a citizen of Israel, I feel privileged to have the opportunity to help in saving life. And as you know, I believe that saving life without border, it's not a motto, it's a way of life. Therefore, we are act now in Bogo City in three main efforts. The first effort, of course, is the medical effort that my colleague will explain later. The second effort is the humanitarian and the civilian effort to reconstruct schools so the education start moving, and the kids will be at school and the parents will go to work. And the third effort is purified water, so there will be no disease after such a kind of tragedy, typhoon tragedy. In behalf of the Israeli country and in behalf of the Israeli citizens, I feel, as I say, grateful to have the opportunity to giving back life and, of course, to help the Philippines during those days. Thank you very much. Itzik.
Good morning. My name is Professor Yitzhak Reis. I'm the Surgeon General of the IDF. The minute we heard about the in the Philippines, we launched the preparedness process for our field hospital, which is a level 3 field hospital that has a lot of experience from previous disasters. We got the command to be prepared, and we immediately launched the moment we got the request from the Philippine government to come here to deploy. We deployed our field hospital on Thursday in the county of Cebu, according to the request of the local government. The hospital is strategically located in Bogo City and serves the Northern Island population. After watching the disaster there, I can surely say that this is a very good location in terms of serving the population medically and with other needs. This is a 148 people facility. It's a relatively big hospital with auxiliary and support services which can be run independently. We set the hospital with full cooperation and coordination with the health authorities in Cebu, and launched primary care, secondary care, and also working side by side with the local hospital. We also set tertiary care for hospitalizations. Until this point, as I talked earlier with the commander of the hospital, we've seen almost 2,000 patients. I don't have time to tell you all the stories, but we've succeeded to save lives. I just was informed that a 1.5 kilo baby born 3 days ago was successfully transferred to Cebu Hospital after resuscitation in our hospital in Bogo City. I heard that a very complicated surgery on giving birth mother was successful and she survived. I heard that the surgery for saving eyesight of a young boy is successful. And there are many stories. But I think the message is not in numbers, and the message is not in the cases. The message is that when you extend a hand with the local people, with goodwill from both sides, and you give the sense that there's a medical support for the population, and even if you see most of the cases that are not connected directly to the disaster, but gives service to the population, I think this is a good message of the local government and of the international community that they care, we care, and I think that will contribute to the efforts done by the Philippines to restore normal life. As I said, we're privileged to be here as physicians, as Israelis, and I have to say something more about the Philippines. We've seen people in disasters, unfortunately, during the last decades that we help internationally. I have to say that the Philippine people behaves gently, delicately, out of respect to each other and out of respect to the ones who come to help. This is something to be appreciated, and we as Israelis can appreciate that. I wish the Philippines to overcome this disaster and move forward to a better future. Thank you.
Colonel Shai, the Israeli Defense Attaché here in the Philippines. Prior to the arrival of the medic team in the Home Front Command, we deployed an advance team that came here last Monday morning. And I must say that in the moment that we landed over here, we got full support of all the ministries and the defense forces to try to operate together and to see how we can support. It was overwhelmed to see in the field in Tacloban. We met the SND to see your leaders in the front, in the field, and supporting the civilians and giving decisions on the field. After we did a survey in several places, we discussed with your authorities, and we understood that it's better to deploy in the Cebu area, because Cebu was not in the, let's say, in the news, but the damage in Cebu, when you go into Cebu, to the islands around Bogo City, you can see that the damage over there is quite similar to the damage in Tacloban. So we decided not to go to the places that are on the TV. We decided to deploy and to help the people. This is our main goal. And we understood that in Cebu province, around the Bogo City, they need help. This is why we decided to deploy over there. Since the delegation arrived and all the defense forces, the Israeli defense forces came from the state of Israel, we got full support. We must say, if we look at other places in the world, the command and control structure here in Philippines works very efficiently if you compare it to the disaster that happened. So we get full support, coordination, and we really appreciate your people and your help. I must say that the cooperation and the between Israel and Philippines, excellent cooperation. We are willing to continue and support and help in the future in whatever will be needed. I must say that we had full cooperation again from the governor in Cebu, from the mayor in Bogo City, and in our perspective, Philippines will never stand alone. Israel will always be with her. Thank you.
I would like to add that last Tuesday, the Israeli government made a donation of medicine worth $500,000, which we gave it to the governor of Cebu to be distributed to the local hospital, the public local hospital, not private. This is a donation. It's one of the first steps in our cooperation with the Philippines. Our government decided also to give priority to the Philippines in programs like education, health, agriculture, water management, which we will dedicate some groups of professionals to come here to work with you, with the national and local authorities, to restore the life in the regions in all the aspects that I mentioned: education, health, water management, and agriculture. This is one of our priorities now in the embassy, and we are looking forward to share with you our knowledge in these aspects. And also we had talks with the D&D officials about creating or sharing with you our knowledge in putting hospitals in emergency cases. Like